welcome back to Dr. U. I'm Dr. Noah. We'll be hosting a little bit of a discussion on hypertension.
And I'm John Ballou.
Well, 1 in 3 adults in the United States have high blood pressure. It's a particular type of condition in the cardiovascular health area where the high blood pressure starts to have a deleterious effect on your body, just like in a car. Your car has pressure like an oil pressure gauge. Too little is not good to push the oil around. Too much, once again, blows things out, and that's what happens with high blood pressure. You start having wear and tear inside your blood vessels. It puts more pressure on your eyes and your kidneys, and so blood pressure is a big, big deal.
I have had something along that line. I was, for some reason, my blood pressure would always be a little high, and it didn't seem to be. No matter what I did, I could eat raw foods, I could work out at the gym, I was drinking all the water, and it just kept getting a little bit higher. I even did chelation. I did some chelation. Didn't touch it. So what's that? I mean, how does? In other words, I did everything I could naturally, I believe, to deal with that.
We'll talk about it. One of the areas that I see quite a bit is in terms of heavy metal toxicity. So that's a factor that
I did some chelation though.
Right, but that only goes with certain types of type of thing. Certain
really?
Types of heavy metals like that, yeah.
So what I did as chelation might not have actually taken.
Well, depending on what kind of chelation you did, if EDTA,
yeah, you did. EDTA,
was it DMSA? There's other ones that kind of have a little different propensities, and so we'll talk about that a little bit later. Some options that you have for that.
Okay.
Blood pressure is the #1 controllable risk factor for stroke. So here's something. Even the medical profession understands that you have control in terms of trying to have an input in terms of reducing that. About 10 million Americans are disabled because of heart attack strokes. And this is the tragedy that I'm sure we've all seen, is that a friend or family member or even acquaintance has a stroke and his or her life has now changed dramatically, where they're not able to talk, they're not able to move, and so that individual quality of life has changed very, very drastically, and some people have actually confessed, I wish I just would have died versus continue like that. So that's not a good. 10 million people are like that. There usually aren't any symptoms, and that's the difficulty. So when you bang your thumb or
that's about 2.5% or 3% of our population is.
Yeah,
that's pretty high.
That is. They're disabled because of that, and there are no symptoms. So it's not like you hurt your back, you get a fever, you feel sick. This is the silent killer, and so nowadays I think most people are familiar with, if nothing more, to go out to a drugstore or to different facilities. But you can even buy now things for under $100. Little cuffs that you do is really a must. I mean, here's some technology that's kind of appropriate technology. Test your blood pressure and kind of find out where you are.
Again, take it into your own hands.
Right. And we want the systolic, the high number, to be at least under 120, and the diastolic, which is the low number, under 80. And then there's different stages like that. So that's kind of goal like that. The cause of 90 to 95% cases of high blood pressure isn't known. So that's where you're kind of going back like that.
Yeah.
That's where there's other factors in terms of toxicity, stress.
How much of it is unknown?
90 to 95%.
Wow. So they really don't know.
Well, I mean, because it's more of a syndrome. It's a multifactorial thing. It's not like if you have viral pneumonia, we know it's due to a particular type of agent.
You can be
virus.
specific.
It's very specific. This is more of a general, what's called a syndrome, or more of a lifestyle type of changes. So it can have lots of different factors that we'll talk about. From 1991 to 2001, the death rate from high blood pressure increased 36%. And so there's, as we talked on an earlier type of video here, there's a growing trend that more and more people are getting sick. The health is, once again, now the exception, not the rule, and so that's kind of disturbing.
It's kind of scary.
It is kind of scary. So we talked about how it affects your heart, your brain, your kidneys, and your eyes, which is an important factor. One thing that is kind of important to do is that we want to make sure we're not misdiagnosed, because blood pressure is used in terms of using this equipment can have some different types of what's called false positive, false negatives, which means more on the false positives. Especially when you go see your drug doctor, you go in, they take one reading, and all of a sudden your blood pressure is high, and what do they want to immediately do? Put you on drugs.
Yeah, immediately.
Immediately, right?
Immediately.
Well, the rule of thumb is that you should have at least 3 of those done.
Yeah.
So The second rule of thumb is that you actually should do it at home, because going to a doctor's office, you have to drive, you have to walk around, and there's what's called the white coat syndrome. It's just being in a doctor's office is a little bit, it's a little stressful.
So wouldn't this also be, again, what we're trying to do is empower the person?
Right.
So if you can kind of take this back and find out a little bit of your own blood pressure based on maybe getting a cuff and checking yourself
That's
at different
right.
times of the day at rest, instead of getting the white coat syndrome, so you're not panicking again.
Well, that's right. This is obviously something you want to be serious about. It's a killer, it's a disabler, but you don't want to just go down a road in terms of immediately taking medication. We're going to talk about some natural things. In this one study here in the Canadian Medical Association Journal showed that 20% of the males and 54% of the females actually had a white coat type of reaction.
Wow.
So for women, almost half of them had higher blood pressure than they should be, just because of the white coat syndrome.
Wow.
So it's really something you want to make sure that the diagnosis is correct, and so you want to be able to do that.
Because once you're on drugs, I mean, you're down that road.
Well, and that's what they're trained to do. Once you're on drugs, you're always on drugs. And as we'll go through the
You may
different
never
types
know
of
what
drugs,
was really wrong with it.
they have different type of side effects. Another study here in American Journal of Hypertension, about a third of the patients who exhibit high blood pressure reading in the doctor's office do not exhibit the same problem when their blood pressure is taken by a nurse. So even different types of health professionals have a different type of feeling. So the rule of thumb is, what you really have to do, is go out and buy one yourself. For a lot of times, you can get them, very inexpensively. Take it at the same time every day. Your blood pressure will go up and down according to day, because
So
that's
you
how it's
start
supposed to.
learning your own body.
You learn your body, so that starts to empower you. You don't
Yeah.
have to rely on somebody else.
Yeah.
And then you make little notes, and then you bring that into your doctor after about a week or two of just taking it home. You shouldn't talk. You shouldn't have to go to the bathroom. You shouldn't have not eaten for a little while after, because those are all natural things that will raise your blood pressure, that will give you a false positive there, and then see where you stand in that. Even in this study here in American Journal of Hypertension, is that, and I have a tendency to do this, a little too much chitter chatter with my patients, you shouldn't really actually talk to them,
Okay.
because that kind of engagement will artificially raise that.